It's the second leading cause of cancer deaths in the U.S., and early screening could help catch colon cancer early and treat it as well. This month is Colon Cancer Awareness Month. In 2021, the recommended age for colorectal screening was lowered from 50 to 45. Hopefully you paid attention to that. Data shows that colorectal cancer cases are on the rise for young and middle-aged adults.
Well, today we have Dr. Swati Patel from UC Health to talk about that. And let's talk about warning signs. What can people or should people be on the lookout for?
Such an important question. Thank you so much for having me here. It's the perfect time to talk about this. I'm biased. I think every time is the perfect time, but
yes,
particularly March, because March is Colorectal Cancer Awareness Month. And what we know is that colon cancer, as you mentioned, is a significant burden to society. It affects all of us, and 1 in 20 of us will get colon cancer if we don't get screening. The current recommendations are that individuals, regardless of whether they have a family history or symptoms, should be getting colon cancer screening starting at the age of 45. However, the best time to talk to your doctor about colon cancer screening is the moment you meet your doctor, no matter how young or old you are. And the reason is because there are other factors: a family history of colon cancer, a family history of advanced polyps, or certain symptoms like rectal bleeding, which may actually require a patient to have their colon evaluated much younger than 45.
I think that will help down the road a bit. I think currently, when I think of it, I don't think we would have known if we had a family history of polyps or stuff. But I think it's studied so much more now that maybe
we're learning
development of these history of polyps or other signs.
Absolutely. And what we know is that polyps, if left in place, can potentially grow, can potentially turn into cancer. And so the big polyps, even though it's a victory when we do colonoscopy and take those out, actually confer the same risk of colon cancer to your family members as if that polyp had grown and turned into cancer.
Wow.
And so that requires our patients to do some homework. Do you know whether your dad had a colonoscopy? Do you know whether he had polyps, how big they were, whether they were the kind that could have turned into cancer? This is the type of homework assignment we give our patients to understand whether they may benefit from colonoscopy or colon cancer screening earlier than 45.
So when most people think of a colonoscopy, the first thought is not always positive. But the good news is, first of all, you don't have to have them every single year. Usually it's 10 years apart. But there are other options out there.
Absolutely. There are a menu of screening options that our professional societies, such as the United States Preventive Services Task Force, really endorse and recommend. There are some options, like colonoscopy, that do require time away from life, family, work, require bowel preparation.
24 hours, really.
But then don't have to be done very frequently, once every 10 years. On the other hand, there are other options that are non-invasive, can be done in the privacy of your home, and really don't require all of those changes. And so the key is to really discuss what's a best fit for a particular patient with their doctor, taking all of these factors into consideration.
Well, we appreciate your sharing the message with us, and we appreciate all the work that you and other doctors do. But you're going to be sharing some of that work with President Biden, part of the Cancer Moonshot mission. What is your plan for that? What are they telling you, and what do you look forward to doing there?
It's an absolute honor, but the utmost responsibility. And I am really excited to join patients, survivors, patient advocates, policymakers at the White House this week. And really the message will be that this is a deadly disease, as you said, the second leading cause of cancer-related death, but entirely preventable. And we need to focus efforts on supporting prevention. Really, despite how effective and the menu of options that we have, what we know is that for those between the ages of 50 and 55, only 50% of us are actually up to date on colon cancer screening.
Wow.
We have a long ways to go.
Getting better. There's more to do, though. I'm looking forward to hearing what happens about your trip to Washington and working with the Cancer Moonshot. So we'd love to follow up with you. And we appreciate you taking time to visit with us and share the message today.
Thanks for having me. I'm proud to represent Colorado in Washington, D.C.
We are proud to have you there. That's great. Thank you.
Dr. Swati Patel from UC Health.